How you sold? Are you okay to do? Oh, fantastic. Thank you. Okay, this will be this recording a little bit horrendous for me because I don't really like being recorded. I think most people don't, but I'll live. Okay, Chris, if we could have the next slide, please, just so we can show everybody what we are going to cover in this short session. So we look at where you can find support for achieving the mental health at work commitment standards. We look at the benefits of the peer platform, like, why would you want to sign up for to it in the first place? And then we'll also have a demonstration from Chris on how to use it, even though it is very user-friendly, very simple. I think it still helps if you actually see it demonstrated. And then at the end, we'll go through some top tips on how really to make the most of it. So if you just go on to the next slide, Chris. Just as a actually, before we move forward, we do mention it's about the mental health at work commitment standards. We assume that you've all signed up to the mental health at work commitment, but in case you haven't, and that's something you'd like to do, there is a link in the chat that Isolde put there to our website where you can do it. It's a very simple, very easy process, only takes a couple of minutes, really. So just a quick look at the mental health at work commitment. What is it actually all about? So far, we've had almost 3,000, you can see 2,840 organizations who have signed up to the commitment. Overall, they employ over 5 million people. And there are many different organizations, big, small, tiny, statutory, charities, private, and so on. So we've got organizations like the NHS England, Marks and Spencer, Home Office, Dal & Santander, a really broad range. And then organizations like Citizens Advice, Happiness Index, Health Watch, all manner of charities and education providers. We also have lots of emergency services. So fire and rescue, police, ambulance. Almost all of them have signed up to the commitment and have done actually some brilliant work in terms of implementing it in their workplaces. So next slide, please, Chris. This is just a little kind of image of various organizations that have signed up, just to give you an idea of a sheer variety of it. Some really absolutely massive ones, but also we're getting more and more small micro-organizations with and self-employed people signing up as well, which is great. And now the next slide, please, Chris. Just a little reminder what these standards are all about. So I'm sure you've seen them all, but just a quick run through it. So the first one, prioritize mental health in the workplace by developing. So this is all about developing a mental health at work plan, but not in isolation, rather using contributions from the whole workforce, with a particular emphasis on the feedback from people with lived experience of mental health problems. And also really getting senior leadership involved. So really getting everybody across the organization involved in this, and also seeking feedback from employees on how to implement things and what's working, etc. Then the number 2, ensure work design and organizational culture drive positive mental health outcomes. So ensure that people work in a physical space that's good for them, that's comfortable, that's nice to work in. Then look at a range of activities like things like recruitment, working patterns, always on culture. What sort of impact do they have on the workforce? Then allow people to have work-life balance and work flexibly. I know there's been lots of talk about that, particularly since the pandemic. And encourage openness and in recruitment and throughout employment. And then the number 3, promote an open culture around mental health. So this is all about increasing awareness about mental health issues and talking freely about mental health issues, and this way challenging the mental health stigma. So demystifying the mental health problems and allowing people to champion mental health and to have open two-way conversations, so not to be ashamed about having mental health problems. And then number 4, so this is all about increasing mental health literacy, so allowing people to attend training, signposting them, training like mental health awareness, how to have meaningful conversations, signposting them for support. I particularly like that we kind of mentioned in one of the recommendations is training and support for line managers, because often they're the ones to have to kind of who are there to support, but you know, what skills do they have to do it, what resources, and who supports them. So and then number 5, provide mental health tools and support. So raise awareness about resources and tools available. There's lots and lots out there. And this is one of the reasons why Mental Health at Work exists in the first place, because we bring the best practice together. So on our website, you can find really information about things that have been tried and tested that really work. But of course, there are many, many other websites out there as well. And then just provide targeted support. So things like targeted support on key contributors to poor mental health. So something like financial well-being in the current cost of living crisis. Very important to provide information about something like that, but there are many, many other issues that you can provide information on. And then finally, the 6th one, it's all about, okay, we are doing things, all sorts of things are going on. How do we measure the impact? So it's all about measuring the impact of the activities we've done, using robust internal and external frameworks. So we give a few examples like Business in the Community Tracker or Minds Workplace Wellbeing Index, of which you will hear a little bit more in a minute. So I think this is it from me for now. I will pass you over to Isolde, who will talk you through support that you can achieve by support that's available to achieve the 6 standards. So over to you, Isolde.
Hello, everybody. So thank you so much for joining us. And yes, alongside the Peer platform, we have some other tools that you can use to help your organization achieve the 6 standards. So the first one is our Mental Health at Work website, which I've just put a link to in the chat, and it's also at the very top if you want to scroll up, just for easy pinning. So on our Mental Health at Work website, we have an absolute cornucopia of free resources. I think we've got about 500 or so at present, and it's steadily being built up even more. They're quality assured, so we have our own process for making sure that they are the best and most up-to-date bits of information for you out there to help you put the Mental Health at Work commitment into practice. We've got case studies and we've got advice, and it's both for well, it was originally designed for employers themselves, so for organizations themselves, but increasingly we're seeing employees themselves use it as well to help improve their well-being at work. So really, we're very proud of it. So do go and have a look. Hopefully it'll provide you with some help to achieving the standards as well. Then we also have our brand new Self-Employed Support Hub. So as Beba mentioned earlier, we have a growing number of small organizations who are signing up to the commitment, which is really encouraging for us. We know that it's really tough out there for everybody, but especially for those organizations on the very small side who don't maybe have a big HR or any HR themselves, and are really feeling the strain. So we created a Self-Employed Support Hub, which you can access to our website as well, and I'll post another link as soon as I've finished. And yeah, that's all designed basically with the best advice out there for those on the very smaller side of things. Then we also have very, very soon to be announced our interactive guide. So this is basically a tailored guide based on your organization's knowledge and journey towards workplace well-being and your size. So when you put those elements in to our guide, we will give you the best, a tailored plan of what you need to do next, as well as all the relevant resources to help you achieve that. So that is in testing at present, so due to be released extremely soon. Also that I don't have on this slide as well, but we have also just released our new auto journey. So this is for everybody who has signed up to the Mental Health at Work commitment. When you sign up to the Mental Health at Work commitment, there's a tick box that will confirm that you're okay to be sent some emails by us, basically the usual GDPR stuff. But by ticking that, you'll be entered into our auto journey, which is an email journey sent at different intervals with tips, resources, best case practices, everything to help you go on your journey to achieving all 6 of the standards. So next slide, please, Chris. Okay, so as well as what we offer on mental health at work, our Minds Wider workplace wellbeing team also offer some really useful tools and products that will help you to achieve the 6 standards. So if you're a bigger organization, you might like to opt for some training. There's both virtual and face-to-face. There is e-learning available as well. We have speaking engagements. There's tailored consultancy. And finally, we have the Workplace Wellbeing Index. So next slide, please, Chris. So we found that one of the most challenging standards that organizations find to achieve is the measurement, that number 6, the internal and external reporting and the measurement of how they're actually going. So Workplace Wellbeing, Minds Workplace Wellbeing, they have what we call the Workplace Wellbeing Index. So it's all about measurement and evaluation. It's where you can take stock of your workplace's mental health policies and practices, and you can measure your progress then against everybody else who has taken it that year. So with that, you also receive tailored recommendations to support your strategy and to help you achieve each of the individual commitment standards. You get a public recognition in the form of an award. There's actually an awards event. And organizations that have taken this in the past have found it a really useful way, once they've received the award, to celebrate their success and share what they're doing for other organizations out there. So it can really serve as a best practice indicator. So it comprises of about 150 qualitative and quantitative questions. And it's designed to achieve reach, impact, and also financial targets. And at last look, although I think this might be a little bit over by now, the last look we captured the views of 250,000 employees from across 354 organizations. So that's one of the ways that you can measure standard 6, or you can achieve standard 6. But newly released as well, which I'm afraid I don't have a slide for, is our snapshot. So this is as it says, a snapshot. So it's a smaller pared down version of the Workplace Wellbeing Index, and I'll pop a link to it here as well, which is it's really been geared to be more flexible, I guess. It takes only 5 minutes to complete, and you get the results within a week of closing. So very similar, but maybe for those who don't have the time or resources to commit to doing the index, which is very thorough. But yes, I will put some links to that as we go along. Next slide, please. Oh, and I think this is back to our lovely Beba, so I'll pass on to you again, Beba.
Yes, I muted myself and then it took me a while to unmute myself. I was wondering, I can only see you, Iseult, on the screen. I wonder if can you see me as well? I can't see myself, so but that's okay. Yeah.
I see you, Beba.
Yeah, That's good. Yeah. Also, I mean, this our offices are quite very environmentally friendly. So if you don't move in a room, the lights go off. So I think because I'm just sitting, the light has gone off. So I'm sorry if I appear in darkness. So just a little bit more about the peer platform. Like I said before, you sign the commitment, but what do you do next? It can be quite daunting. We do offer a lot of information, as we just mentioned, on our website, but really, where do you start? And also implementing the standards will be different for different organizations, because as we mentioned, some are small, some are large. There is the self-employed people are more and more involved as well. So where do you start? So despite these differences, there will be a lot of commonalities as well. You will have a lot of similar experiences. So this is why we created the peer platform, really. I think the main thinking behind it was, why reinvent the wheel? So if you've done something and it worked really well, share it with the world so others can do it. If you've done something and it didn't go so well, share it with the world so the others can do it. So this way we can all learn from one another, and also become a part of this big workplace community that work towards a better mental health in all our workplaces. So in a nutshell, the peer platform is a space where you can connect with professionals from organizations of a similar size and sector to help each other to deliver the 6 standards. We ran a pilot in February. We invited over 300 organizations to take part. Quite a lot of them did. We used the feedback we received to streamline the platform to make it even easier to use. And then we went for a full launch on the 30th of June, when we launched it to all the signatories at the time. So it was about 2,500 organizations. And so far, 126 organizations have registered, but the number is going up all the time. So if you just move to the next slide, Chris, and we will look for the benefits for those who are seeking advice. You can ask questions, receive ideas, resources, and tips on how to put particular standards, particular recommendations in place. This hopefully will give you a new perspective of implementing the standards. It will also help you identify strengths and weaknesses, both of your organization and your own, perhaps. Also help you develop the skills and capabilities across the organization, and enable you to access support and networking opportunities. And if you just look at the next slide, really, it's about the benefits for those who are offering support. It really mirrors the ones that we just looked, because even though it's a two-way process, so even though you might be offering support, that's also a learning opportunity. So it's also about sharing experiences, ideas, resources, and so on, also gaining a new perspective. And also there is always a satisfaction from helping others to overcome challenges. And also just, I think, satisfaction of this broader idea of improving our workplaces generally. Also a potential to develop new skills and access support and networking opportunities. So the way we see it, there are lots and lots of positives in sharing good practice, but also challenges as well. So that was our reason for setting it up. But I will now pass you over to Chris, who will show you a practical demonstration of how actually to use it on the internet. So. Isolt, you're on mute, and maybe Chris, you are.
He is indeed. I was on mute to say that Chris was on mute.
Thanks very much. Sorry about that. Yeah, so sorry, I'll get started again. Thank you, everyone. Yeah, so I'm going to take you through how to use the platform. The platform can be found on the Mental Health at Work website, and also the URL is posted to the top of the chat. So when you click on the URL, you'll come to the home page, and the home page will introduce the platform. So you've got some initial information on the platform and its purpose. Now you will see as well from the home page, you can learn a little bit more in terms of the standards, how the process works. So you've got plenty of information before you create your account. When you come to create an account, it's quite simple to create your account. Actually creating and registering an account doesn't take long at all. You can be a recipient, so someone who is looking for support and implementation of mental health at work standards, and you can also be a supporter, or you can be both roles on the platform. If you join as one role, once you're ready to be a second role, you can just do that through your through editing your account as well. So I've created an account just to save us a little bit of time. I'm going to start as a recipient. So log into my account, and when I log into my account as recipient, the first thing you'll see is there are plenty of resources, a lot of the ones that Bebe and Ishalt have referenced. So there's a webinar series here, and also there are supporting resources for each one of the standards. So you've got those on registration. You've also then got another section in terms of when you connect, how to get the most out of the connection you're in, the relationship you're in between the recipient and the supporter. You'll see that some of these resources will also appear once you have connected with a colleague on the platform. When you're ready, your next step is to create a profile. So the profile serves two purposes, really. The first is you're just placing, as in this case, a recipient, so somebody who's looking for support. You're placing a little bit about yourself, your organization. So I'll complete this as we go along. Just identifying your industry sector, where you're from, size of your organization, number of employees, your role in implementing mental health at work, your experience. And there's just a couple of questions in terms of your understanding of the standards, where you are in terms of implementation. And then you're making a choice around how you'd like to conduct the relationship, so in person, online, over the phone. Then you're picking a couple of areas that you would be interested in getting support on. So let's just pick a couple of these. So I'm going to choose promoting an open culture around mental health, increasing organizational confidence and capability. So you can pick areas of knowledge you'd like support with, and also areas of information, knowledge, tips, and resources. So I'm going to choose encouraging openness in recruitment and increase mental health awareness and challenge mental health stigma. And then you've got the opportunity to put a little bit about yourself in terms of your personal statement, just to sort of give a little bit more background to the recipient. You can add a profile picture if you choose to. And then when you save your profile, the platform will bring back the supporters on the platform who are best able to support your request. So you can review those search results. You can then view the details of the supporter. If at this stage there's something on the supporter's profile that you'd like to ask a question about, you can ask a question before you send your request. When you're ready, you send the request. So we'll send the request to Lester, who's our supporter. And then from a supporter point of view, so the platform works on a series of engagement emails. So in this case, Lester will get an email into the email he's registered onto the platform with. So you don't have to keep going into the software to see what's going on. You'll get email alerts when you get a request, or if you're organizing a meeting, or if you've got a message. So Lester will log in to his account, and he will see this request from me. Clicks on that, my request comes up on screen. So Lester, the supporter, will be able to see the support I'm looking for. As a supporter, you could decline the request. That shouldn't really, because you're too busy or you're already supporting enough people, because you can use the edit account function to come out of searches if that's the case. So if you're already helping enough recipients, or you're going through a busy time at work, you can pull yourself out of the searches. As a supporter, you can ask questions of the recipient in the same way as the recipient can ask questions of the supporter. We're going to accept. And when we accept, you're then reminded of the resources around getting the most out of the relationship. So you've got those resources to refer to. And then what we'll do is we'll just quickly close the loop. So we'll go back to the original recipient account we set up. So as a recipient, I've had an email to let me know that Lester has accepted my request. And then that opens up a dashboard where I've got messages. So you can message through the platform. I've got my meetings and my video, goals. As a recipient, if I click on next steps, I've got the same resources as the supporter, except mine are designed for my role as recipient. So you can use these. You can start to think about, where you are in your career, in terms of mental health. So you can create SWOT analysis. You can use the G-STAR model, which will help you start to think about the goals you might want to try and achieve in the support you're looking for. Again, there's lots of useful helps and tips here. Let's quickly point out again, so you can organize your meetings. You can set goals between with your supporter as well. Just set a couple of goals so you know what you're hoping to achieve if you choose to. And then just the one thing is, when you come to the end of the relationship, the request is if you could just close that out. So when you've completed or you've received the support you were looking for, if you could just close the journey out and complete the survey, that would be great. And then Bebe eShults will get the feedback from you that they can then act on in terms of growing the program. Okay, so hopefully that was straightforward. I'll pass back to Bebe now.
Oh, thanks, Chris. We actually did have a question for somebody asked if Jen asked if you can demonstrate again how to fill in the profile. I believe, would that be possible?
Yeah. Yep. So I'll just go back to the profile I created. So once you've joined, in terms of steps, once you've registered for an account, you'll have the resources, so the supporting resources. And when you've had a chance to look at those and you click on Create Profile, this is what you'll come to. Now, this is a profile I created as part of the demonstration. At any point you see as a recipient, let's say, for example, these areas of knowledge you'd like support with, you get that support, and then there's something else that somebody could potentially help you with on the platform. You can change these areas. You can look for others, and then you can send another request. But hopefully it's not, the profile doesn't ask for a lot of information, really. And I suppose in terms of its use in the program, when you find a supporter you think can help you and you send your request, it's the information on the profile that goes to them, so they've got a little bit of background and they know what you're looking for support with. So taking a little bit of time to complete your profile is obviously good, because the more information the supporter's got, the easier it will be for them to understand how they think they can work with you. So hopefully that answers the question, but we might have that at the end of questions as well. I'll pass that back to you, Beba.
Yeah, thank you very much, Chris. And yeah, like we said, if you do have any further questions once we finish this session, feel free to write to our Mental Health at Work inbox, really. So and we'll do our best to answer them. So we're almost at an end. So if we just move on to the next slide, Chris, we just have a few tips which hopefully will be useful for you to make the most out of the peer platform. And they are actually in the resources once you register for the peer platform. So just think about like practicalities, like when you can meet and how, there are various options on how you can meet. And preparation, as always, think in advance about what you actually want to get out of the meeting and prepare for that meeting accordingly to make the most out of the time you have. Building a relationship now, probably most of the relationships will be one-off conversations. It's still a relationship, but if it goes on for a longer period of time, then be prepared that to build that relationship, really, to let it develop. Listening skills, well, what can I say about listening skills that we don't already know? Just a reminder that they are the most important part of communication skills, really. And they kind of go hand in hand in questioning and understanding. So do ask questions and do make sure you understand it all. There is a saying in the training world, there is no such thing as a silly question. And I think that can easily be applied to this situation as well. Don't be afraid to ask questions. Yeah. Giving and receiving feedback, again, just make sure it's objective, it's from your personal point of view. Do give feedback, do be prepared to receive the feedback. It's one of the key components of using the platform. And then also be prepared to act on what's been agreed. Yeah, it's a bit of a journey. That's how it was set up. The platform itself was set up as that, with the beginning, and then it develops in the middle, and then there is the closure. These are some of the tips that we can offer, but I'm sure you'll have many other ideas. And we'll just finish with, if you move on to the next slide, Chris, we have a testimonial from somebody who used our platform, and it's, I mean, you can read it for yourselves. So it was a positive experience, and we thought it would be worth sharing it with you. So this is obviously somebody from the educational setting, which, as you can see, is a particularly busy kind of setting. Yeah. Well, finishing with this, this brings us to the end of our session. So we have 3 minutes left, but we can go on a little bit longer if that suits you. We don't have to. Are there any other questions or anything, Isolde, to Chris, you'd like to add to what we've covered? And yeah, just to mention, you're welcome to post your questions to the Mental Health at Work inbox, but also any comments on this webinar, how much you enjoyed it, how it can be improved, because we might do it in the future. So any comments, any feedback. I'll just mention giving and receiving feedback. We'd love to receive some feedback. So
just a couple of questions in the chat. One is, how long is it anticipated that a peer relationship lasts? I know we touched on this briefly. It's really up to you, I think, is the answer, and what you need to get out of it. So we found that some of the relationships are really short because they revolve around a very specific question and a bit of kind of easy advice that solves the problem, and others are really much more long lasting, and they can involve lots of different elements, and the relationship is ongoing. It completely depends on your needs and how you get on with the person that you're either supporting or what's the other word? Supporting, or I'm having a mind blank. The other word.
Seeking support, you mean?
Support, that's it. Apologies, I definitely need another coffee. Somebody else has said, not sure whether to start as a recipient or a supporter. It's completely up to you. You probably, if you are not just starting off from scratch, you probably have much more to offer people than you believe. I would say go for it. If you've had any sort of positive examples of things that you've done to increase the well-being of your staff, even if it doesn't necessarily, or you're not sure exactly how it falls within the standards, I would go for it. You will see when you're signing up as either a recipient or a supporter that it's broken down into what elements you can help with or that you'd like help with. So have a look through them and see what you think might work for you. But I would suggest go for it. I mean, if it's worth taking a punt, I think. I'm sure you'll have a lot more to offer people than you might believe at first point. Anything else? Let's have a look. Can all the links in the chat be shared with us? Yes, of course, after along with the recording. Yeah, absolutely. No problem at all. Am I missing anything else? I'm not very good at using my pop-out. Let's have a look there.
Okay. Somebody
just say sorry, just to say there was a bit of talk in the chat there as well, and I just wanted to be clear that it is not the posting about the links to the index and the snapshot. This program is completely free, the signing up to the commitment, as is the peer platform, absolutely free. We have just found that the index in particular, because it's been going on for quite a while, is really helpful for helping to achieve standard 6, but there are lots of other free ways to achieve it as well. And I posted a link to one of our toolkits around achieving standard 6, which is featured obviously for free on Mental Health at Work, that you can access. And we've done toolkits for all of the standards, and we'll be increasing kind of our offering there as well, but you'll find lots of free advice and stuff there as well. Also, sorry, I've just seen another element in the chat there. I think somebody has posted about not having a great experience at the first attempt at linking with somebody. Would you be able to elaborate on that? Because we're always looking to improve things. I would love to know a bit more how to make it better for everybody in the future. Either in the chat, or you can send me an email, or if you're comfortable going online and or going off mute and telling us, go for it, whatever you like. And just while we're waiting, if anybody doesn't have, I've just seen, what if you don't have any answers, questions are being asked, just be honest about it. Nobody has all the answers.
Yeah.
And
I
again,
think
sorry, Beba, I'm terrible with this. Somebody has also asked, I think it's Susan, that you're a micro organization and you do lots of wellbeing announcements, training for awareness sessions, and you have a mental health first aider and EAP service. That's amazing. You've signed up to the commitment, but you're not sure if you can actually deliver on all of the 6 areas. I'm a firm believer that just because you don't think you can do everything is no reason not to do anything at all. It's quite okay. And you will find that I'm sure there are ways that you can deliver all of them as you're going on. Hopefully in the peer platform itself, we might be able to help you with that. But it's always better to do something.
okay. I think people are leaving. I think we're down to 35, which is still quite a few. And yeah, we've gone a little bit over time. So I think
I'm just going to post. Apologies. I'm just going to post our email address for anybody who does want to ask another question or thinks of something while we're still here. Just bear with me a few minutes. Apologies, my tech is playing up a little bit. But we will send you this, we will send you all of the questions and the recording as well. So not to worry about having lost the chat or anything like that as well. So yeah, but everybody who's attended today will get a follow-up email from our email address with the chat and the recording. So yeah, feel free to shoot us a message and ask anything you might like to ask. Great.
Yeah, I think that's it. Yeah. Well, thank you very much for everybody for attending and for listening and for asking some really interesting questions. So yeah, we'll be sending you some more information, and in the meantime, do feel free to email us your further questions and feedback as well. And have a lovely afternoon.
Thank you. That was great. Thanks a lot. Bye.
Thank you. Okay. I've saved most of the chat installed.
Super.
I think I can't remember how to actually save it, so I've copied and pasted it.
You're very good.
I haven't used the Zoom for so long. It's weird because I used to use it all the time before.
I hear you. I'm the same.
Very strange.
I always get mixed up about how you do things on Zoom compared to Teams.
Teams, yeah.
Just have a look.
Okay.